10?
Probably 12. So for like top 5.
Where does Canada rank in infant mortality? In 1987, Canada was ranked in 6th place. By 1997, surely you would think that such a prosperous country would increase its ranking. Well, that's not the case. In 1997, Canada was ranked in the 15th spot, and as of 2007, Canada has continuously been ranked in the 26th spot out of 34 OECD countries. Why is that? Why is such a rich country that spends considerably more on their healthcare system compared to other countries ranked so low on infant mortality? Well, that number is driven higher because of the disadvantages amongst the Aboriginal community. Aboriginal infant mortality rate has been documented being up to 4 times higher than the nation's average, although due to underreporting, it may be 6 times higher. So why is that a country where the healthcare system functions in a way based on medically necessary need rather than status, do infant health inequalities exist in subpopulations? There's a lack of healthcare services within Aboriginal communities, and if services are readily available, discrimination and ignorance often occurs. There's also a lack of Aboriginal healthcare providers and that often causes insensitive and culturally inappropriate care. There's a shortage of healthcare funds for Canadian Aboriginals, and when the government is responsive to their needs, funding usually doesn't last. Therefore, many positive effects achieved through monetary gains are lost once funding ceases. Other countries are attaining better infant health outcomes by decreasing the prevalence of status disadvantages, something Canada should adopt because typically we focus on social determinants of health without candidly considering how unequal distribution causes health disparities.
Like 11, maybe 8.
Maybe in the top 5?
According to the World Health Organization, mental health is an important component of overall health. So why does it seem the Canadian healthcare system seems to ignore mental health if it's so important? We spend so much on healthcare each year, about 1.5 times more than either Japan or Italy do per capita. Yet somehow we rank lower than both these countries in both mental health and overall health. Where does all our money go? Well, I'll tell you, Medicare doesn't cover privatized mental health. In Japan and Italy, mental health care has been incorporated into the public health setting, and it's covered the same as if you were to visit your physician. Is it any wonder why Italy ranked 2nd and Japan ranked 10th in world health while Canada ranked a measly 30th? Hey, at least we're better than our neighbors, but unfortunately not by much. But then again, the Americans rank as the worst country in terms of years lost due to depression. So at least we're better than the worst. As you might expect, Japan ranks the best in this area, and Italy is not far behind them. Our healthcare system is in need of a change, one that publicizes mental health options for Canadians.
7th.
8, yeah, that would probably be in the top 10. Yeah, that's good. Yeah, like that at least.
About 1.4 billion of the world's population is overweight. That's 10% of the world. Let that sink in. The WHO and every other organization that measure obesity are using the body mass index. So where does Canada stand within all these numbers? Well, approximately 1/4 of Canadians over the age of 18 are obese. That's 8,720,000 people. Not only is that a large number, but also the rate has been doubling in the past 2 decades. Between 1985 and 2000, 57,000 people died because of obesity-related causes. Today, that number could possibly be higher because of the prevalence rate of 62% of overweight and obese people in Canada. Canada today stands at 6th highest in obesity in OECD countries, not far from our neighbors to the south, USA, which is at 33.8% of its population being obese, and Mexico at 30% of its population. Other countries such as Korea, Japan, and Switzerland are helping their citizens by implementing low sugar and low salt additives on store shelves. They're also taxing people on high calorific drinks and therefore reducing the amount of consumption. Canada spent over $100 million in research to find what is causing this number to keep growing. Well, if we open our eyes a bit wider, we would see that all these fast food chains and high sugar foods aren't helping us make the right decision. Obese Canadians are costing the government and the taxpayer billions in healthcare expenses and unemployment costs because apparently obesity is matched with inefficiency. So hey Canada, let's start taking this infant mortality, mental health, and obesity rates seriously and actually implement programs and policies to help our overall health and live towards having the #1 healthiest country.